Welcome to the first presentation within the health assessment course. It is a presentation on communication and subjective data collection. My name is Melissa Downs. The purpose of this presentation is to explain the nurse's role in communication and collection of subjective data and how those relate to the assessment of the client. By the end of this presentation, you will be able to discuss the nurse's role in patient-centered care regarding respect, privacy, confidentiality, and advocacy. Compare and contrast the 4 basic types of nursing assessment, including initial comprehensive, ongoing or partial, focused or problem-oriented, and emergency assessment. You will be able to describe the steps of the assessment and nursing diagnosis phases of the nursing process, describe the phases of an interview, identify the major categories of a complete health history, and lastly, describe the use of therapeutic communication and effective verbal and nonverbal communication. I realize that learning conceptually or learning in a concept-based curriculum is probably new to you. So I want to start off this presentation with the concepts and the exemplars or examples that we will be learning in this first week of health assessment. The concepts are advocacy, clinical judgment, therapeutic communication, and caring. And you see under each of these concepts the exemplars that we will be learning together. Privacy and confidentiality, collecting subjective and objective data, interviewing, effective listening, and patient-centered care and respect. So let's start the presentation looking at the concept of advocacy. Advocacy is defined as support of the client's health, wellness, safety, and personal rights, including privacy. And as we look at this nursing profession that you all are embarking on, I want you to be aware of the American people trust nurses. In fact, in a 2020 poll, 89% of Americans rated nurses' honesty and ethical standards as high or very high. So when clients come into the healthcare system, they are expecting nurses to be their advocates. They're expecting nurses to take care of them, to make sure that their rights are protected, to make sure that their privacy is protected. There is something that I hope you've heard of called the HIPAA Act, which stands for Health Insurance Portability and Accountability Act. It was an act that was created or put into law in 1996. And what I need you to know about is that this law ensures the confidentiality, the integrity, and the availability of patient health information to be maintained. You know, it's to protect and identify that any type of threats or risks that a patient's information would be inadvertently disclosed or would be shared with people that did not have the right to know that information. So your textbook goes into some detail in the chapter 1 about the nurse's role in health assessment and how it has evolved. I want you to realize that every healthcare professional performs assessments on clients, and the purpose of those assessments are to guide their professional judgments, to make plans for their clients, right? So the nursing assessment is much more of a holistic approach. So it involves the mind, the body, the spirit, and trying to get the client in an overall level of functioning or a level of wellness. And the nurse collects data that includes not only physiologic data, but psychological data, data on their sociocultural development, their spiritual information. We collect data on how the clients interact with their family and how they interact with their community. As opposed to a physical assessment, which really focuses a lot more on the physiologic status of the client. So know that the purpose of the nursing health assessment is to collect both subjective and objective data to determine the client's overall level of functioning, so that we as nurses can make clinical judgment and guide our nursing care appropriately. In the book, I think it talks a little bit about if you like a physical therapist focuses on how the client's musculoskeletal system works and how it affects their daily living. So like if somebody has had a hip replacement, the physical therapist is going to be honing in on that type, where the nursing assessment looks at everything, the mind, body, and spirit, and how the clients function in their life, how well they are. There are 4 basic types of nursing assessment: the initial comprehensive assessment, the ongoing or partial assessment, focused problem-oriented assessment, and emergency assessment. The initial comprehensive health assessment is the assessment that focuses on how the client's health status affects their activities of daily living. So how the client's activities and their choices affect their health status. And it is done when the client first enters the healthcare system. It establishes basically a baseline of data, and that's the baseline against which any future health status is measured or compared. Okay, so it's kind of like laying the groundwork for identifying the client's healthcare or health problems that need further exploration or validation during a physical exam. It includes both subjective and objective data, and it really depends how often you do it. Depends on how the patient's age and what their risk factors are and their lifestyle. Okay, the ongoing or partial assessment consists of data collection, but that it's done after that comprehensive database is established. It's really a mini overview of the body systems, and in that initial comprehensive assessment, any problems that were initially detected are reassessed to see if there's any improvement, to see if it's getting worse, and again, the frequency of this type of assessment is really going to depend on how sick the patient is, or the book calls it the acuity of the client, but basically how sick the patient is. A focused or problem-oriented assessment is performed, again, after the comprehensive database exists, and it consists of a thorough assessment of a particular client problem. So anything that is outside of that problem realm, you're not going to assess in the focused assessment. So if your patient comes in with ear pain, the book gives the example of ear pain. That focused examination, that focused assessment is going to focus on that ear. It's going to focus on what that pain is like using a mnemonic called cold spell, which we'll talk about in a minute. And then the emergency assessment is just a really rapid assessment going on in a life-threatening situation. So it's gaining immediate assessment so that you can provide prompt treatment. Remember, your assessment is done so that you can analyze it and then intervene. In an emergency situation, like somebody who's come in in cardiac arrest, somebody who's choking, somebody who has had a drug overdose. You're not going to go through and talk to them specifically about how they're functioning in their lifestyle and looking at the mind, body, and spirit like you would in an initial comprehensive assessment. That emergency assessment is a quick, rapid one because you need to deal with the life-threatening situation that's at hand. So the nursing process, which is also abbreviated, or the acronym is ADPI, you might hear it called ADPI, is a dynamic, continuous, client-centered process. And there are 5 steps. You see them here. It starts with assessment, diagnosis, planning, implementation, and evaluation. And it's basically it's a framework which we as nurses use to apply our knowledge, our experience, judgment, and skills in order to help our client achieve outcomes. And Professor Ray will be going into this in some detail on Wellness 1 as well. But I want you to know that the nursing process begins with assessment. And we have an entire course on assessment and what that means, because the assessment is really the foundation. Think of it as like a house. And this is the basis, the ground level, if you will, of everything that we do for our clients. And we will dive deeper into this nursing process. But I wanted you to see at the very beginning that it is, again, a cyclical process that begins with assessment or data collection, which is what this first week presentation is all about. I really liked this picture taken from your textbook that goes into the 5 phases of the nursing process in more detail. I think it's a very good visual to explain the nursing process in more detail. The assessment phase of the nursing process has 4 major steps: collection of subjective data, collection of objective data, validation of that data, and documentation of that data. Before you actually meet your client at the beginning of the nursing health assessment, you need to get prepared. You will do this by reviewing the client's medical record if one is available, and this will guide your interactions with your client. Keep in mind that these steps often overlap, and you may be doing these steps at the same time. But these are the 4 steps of the assessment phase of the nursing process. So the assessment phase was the first phase or step of the nursing process, and it comes before all the other steps. But as nurses, you need to make sure that you're aware that the assessment's ongoing and continuous throughout all of the phases. So you really need to think of it as a circle or circular instead of linear. And those ongoing assessments, the frequency of them is really determined by how sick the client is, or the word acuity, how acute, the level of acuity of the client. So the second step of the nursing process is the nursing diagnosis or the analysis step. And this is where the collected data that you as nurses will collect based on clients' answers to the questions, subjective data, in that nursing history, along with the objective data that you will gather during the physical assessment. That data is evaluated or analyzed by the nurse to make informed judgment about the client, including nursing diagnosis, collaborative problems, referral, and the need for patient education or client education. And this is the phase where nurses use critical thinking skills to identify the client's health status or their problems, interpret or monitor that data, and reach appropriate nursing judgment about the health status and the coping mechanisms to provide direction for further nursing care. Okay, so it's at this phase where nurses recognize problems or patterns or trends, compare that data, and arrive at conclusions to guide the nursing care. The beginning of chapter 2 in your Weber and Kelly textbook talks about the phases of an interview, and there are 4 basic phases: the pre-introductory phase, the introductory, working, and then summary or closing phase. It's in that pre-introductory phase or pre-introduction that the nurse will review the medical record before meeting the client. In the introductory phase, the nurse introduces herself or himself to the client and explains the purpose of the interview. And this is the phase where the nurse develops trust, develops rapport with the client to hopefully be able to collect that subjective data. And then the working phase is where you get the bulk of the history and review of the body systems, or the ROS the book talks about, and the current problem that the clients are having. And then in that summary or closing phase, this is where you're validating the problems and working with the client in that patient-centered care where the client is the center of all care, and creating goals with the client, and clarifying any questions that the client may have. The categories of a complete health history include this information. So there's 8 sections in a health history: the biographical data, the reason for seeking health care, your history or present health concern, past health history, review of systems, and it's often abbreviated ROS, lifestyle and health practices, and developmental level. If you go to your textbook and you look at assessment tool 2-1, it'll give you all of the information that's in each of those categories. And we will be practicing these in the lab as well. Now let's talk about communication. Let's talk about how you as professionals can gather the subjective data needed to begin the 5 phases of that nursing process. So the health history is obtained through subjective data. Okay? In order to be an efficient interviewer, you need to make sure that you have interviewing skills that are professional, that are responsive to your clients. You need to establish a trusting relationship with that client, build a rapport with that client in order to gather your information. So I realize that some of us may be a little bit more natural in therapeutic communication than others. And some of us are going to need to practice these techniques I'm going to talk about and just basic communication with our clients. So I wanted to take a little bit of time and talk to you about how you should initiate your interview. It is a huge pet peeve of mine when somebody comes into a medical office building and you're meeting somebody for the first time, for somebody not to tell you their name. And I will go in as far as saying, "I'm sorry, my name's Melissa, I didn't catch yours," if they dive right in and start asking me questions. Huge pet peeve of mine. Make sure you introduce yourself and tell your client what it is they can expect from this assessment. Also, ask them what they want to be called. You know, do they want to be called Mrs. Downs? Do they want to be called Melissa? Avoid calling them honey, sweetheart, sugar pie. Those are all things that are not professional, and you should avoid at all costs. When someone is interviewing an older adult, there are many reasons that you will need to allow for more time. They might not hear as well. They might process things slower. When you're interviewing the client, make sure they're comfortable. Is the room temperature comfortable? Are they in a chair seated comfortably? If you can, before you start into a more invasive part of the exam, start asking those health history questions. Perform a general survey, get vital signs. Try to establish that rapport of your client at the beginning of your interview. Make sure that if there's people talking or the TV's real loud or, other things other environmental noises that are going to impact how you interact with your client, that you eliminate those distractions. Understanding that what you're saying is huge with many clients that maybe English is not their first language or they might not be able to hear well. Always in your interview, make sure they're understanding and can and are processing what it is you are assessing. Note your client's nonverbal communication. How are they sitting? What's their posture? Are they making eye contact? Is what they're saying match up with how they're saying it? And lastly, and this is huge, make sure that you do not use medical or nursing jargon. You don't go in and say, I'm going to auscultate your lungs. No, you're going to listen to what their lungs sound like, or you're going to look in their ear instead of, I'm going to use this otoscope to inspect. You want to use terminology that makes them comfortable and establishes that rapport. Really important to avoid giving advice. You really want to make sure that you don't offer false reassurances if they're not, do not offer false reassurances, and always explore clients' feelings. Don't ignore what they're feeling or how emotional they are. Therapeutic communication is a tool for providing holistic and patient-centered care through respecting boundaries and empathy. Using these techniques can be a little challenging if you haven't done it before, but they're very important to learn and practice so that you can elicit subjective data from your client. These therapeutic communication techniques I took from the ATI book. Know that ATI as well as NCLEX will ask questions specific to therapeutic communication techniques, so I'm providing that data here. You can also find that in the ATI Fundamentals page 127. So the technique of active listening shows the client that you are giving them your undivided attention. It shows them that they are respected and that their concerns are being heard. Open-ended question is a great way to use initially at the beginning of an interview where you're encouraging the client to tell their stories. You can do this by saying things like, how have you been feeling lately? Or how does that make you feel? Typically, open-ended questions begin with the words how or what. Clarifying questions are used when you want the client to either give you more specific details, give you greater details, or direct them toward relevant parts of their history. Back channeling is a technique that uses active listening phrases such as go on and tell me more to convey interest and really prompt disclosure of the entire story. So if they're talking and giving you information on their history or the story, by using that back channeling, that shows them that you're listening, you're using active listening, and again, that you're respectful and you're wanting to hear what they have to say to you. Probing is a technique that helps you gather more comprehensive information. So asking things like, what else would you like to add to that? If there's if the person stops in the interview and you feel like they're not telling you the complete story, that's a good way to get them to communicate effectively. Closed-ended questions typically are questions that begin with the words when or did, and they are questions that are useful to keep the interview on course. So for example, if you've asked a client, how have you been feeling lately? That's an open-ended question. And that client starts talking about how my stomach is really painful. I don't like to eat because I feel sick to my stomach. You can follow up that answer to when did that nausea start? Okay, it's not a yes no, but it's a very they're gonna say Monday or Tuesday or about a week ago. So it's a very closed-ended question. It's either a yes or no answer that they will give you, or it's a short phrase, kind of a shorter response, if you will. Summarizing is a way that you validate the accuracy of the story being given to you. These are all therapeutic communication techniques that you should become familiar with to use in the interview process to collect subjective data. These verbal communication strategies are also listed in your textbook. A laundry list strategy would be something like asking the client that has come in complaining of pain. You ask them, is the pain severe, dull, sharp, or piercing? So you're giving them a list of choices to choose from. Rephrasing is a technique that helps you clarify information that the client has already stated. Well-placed phrases is a technique that encourages the client to give you more information. And I mean by that, I mean the client's in the middle of explaining something to you, and you want to make sure they know you're using that active listening and you're being attentive. So you say things like, oh, yes, I agree. So that's well-placed phrases that you use to encourage the client to continue to explain their feelings or their symptoms. Inferring is when the client tells you information, and then you observe something in the client's behavior that you need to verify that data from. So there's an example in your book. Basically, the technique, if used properly, helps to elicit more accurate information from the client. Providing information throughout your interview, the clients are going to look to you for answers to their questions. It's very important that you provide information, you provide answers thoroughly, but at a level that they understand in their own jargon, their own terminology. Other things to consider in the interview process with verbal communications include age and gerontological variations in communication. Older clients may have a harder time of hearing. They may want you to speak clearly and straightforward to them, slowly. They want to feel respected. They don't want you to yell at them or act like they may be confused just because they're older. Cultural variations in communication. There's a lot of things to consider in a person's culture, and I would like to say here that if a person's English, if English is not their primary language, you need to make sure you get an interpreter in and you get somebody in that understands the culture or can explore the culture with you. And then emotional variations. So you're going to come across clients that are not necessarily pleasant and calm and friendly in the interview process, especially if you're dealing with some high emotions for whatever reason. They've just been diagnosed with an illness, or they're depressed about some life events, or for whatever reason. So you need to know how to handle patients that are aggressive or anxious, patients that are depressed. And there's a good part in your book, box 2-3, that discusses that. Nonverbal communication is as important as the verbal communication that you have with your client. I want you to be aware of these nonverbal things that will communicate how a person feels. So this is important for you to be aware of your nonverbal communication as well as the client's nonverbal communication. So all of these points that I have listed here, the general appearance, the dress and grooming, the attitude, that is as important for you to make sure you are portraying professional nonverbals as well as picking up on some nonverbals that your client may be presenting or communicating, if you will. It's important for you to avoid excessive or insufficient eye contact. Avoid extremes in eye contact. If you have excessive eye contact, the client may feel uncomfortable. Too little eye contact might lead the client to believe that you're hiding something. So a moderate amount of eye contact communicates that you're interested and you're focused. You want to make sure that you are not too distanced or distracted when you're communicating with, when you're interviewing your clients. Make sure that there's a moderate amount of distance between you and the client and you're not acting distracted. You're attentive and actively listening. And lastly, standing. There's some research out about when you are when clients and healthcare providers are interacting. If someone is standing and the client, let's say the healthcare provider, let's say the nurse is standing and their client is sitting, kind of gives, communicates a superiority type relationship where we want to foster a patient-client relationship that's collaborative and not superior. So you want to avoid standing during an interview. Sit down next to them, make good eye contact, and make sure that you are actively listening and asking appropriate questions, and your nonverbal communication matches your verbal communication. Other communication to avoid in the verbal communication category, if you will, is you want to make sure that you are not, you want to avoid using biased or leading questions. For example, "You don't feel bad, do you?" is an example of leading the communication. So you want to avoid that. You want to avoid rushing through the interviews. So that means when you're asking questions, you pause. You don't ask questions right on top of each other. And as soon as the patient answers a yes or no, you like. It feels like you're rushing through the interview. And lastly, you want to avoid reading questions right from the history form. You and I have been in communication in an interview, I'm positive, in a client interview, where your nurse or your doctor is just literally has the paper in front of their eyes and they're reading right from the piece of paper. It just makes the client feel unimportant. So just make sure that you are gathering basic information, keeping an open mind, avoiding premature judgments, because that can alter your data collection. So when you just have to be aware of these verbal communication pitfalls, if you will. This is an example of a genogram. A genogram is a visual family mapping tool, and it allows clinicians to diagram a client's family history through generations. And it is helpful in constructing patterns. So being able to look at disorders or family history, disease processes, and how it relates in the family history. It's just a visual mapping tool. This cold spa is a mnemonic that will help you analyze your client's symptoms. It's often used when you're asking a client about pain. In your textbook, box 2-4 has some examples of different questions that you would ask to get the answers for this mnemonic. So for example, if you're trying to just have the client describe the pain, for character, what does the pain feel like is a good question. You always want to know when it has started. So O is for onset. When did the pain start? L is for location. Where does the pain hurt most? Where do you feel the pain? D, duration. How long does the pain last? Does it come and go, or is it constant? Severity is how bad is the pain. And it's real important to note that you're giving your client a scale. So from 0 to 10, how bad is the pain? 0, there's no pain. 10, there's never been more pain in my whole life. P is pattern, and basically it's asking what makes your pain better or worse. And that's a really important question to ask so that you can implement your interventions to assist your patient. Associated factors, or how it affects the client, would be something like, what do you think caused it to start? Or what other symptoms occur with it? Is there any pain that's radiating? How does it affect you? Those type of questions. And this is a mnemonic that you will use starting now until, through your nursing practice. So it's a way to elicit more information from your client with their symptoms. This table was taken from your textbook, and I think it's a good representation of comparing and contrasting subjective and objective data. Remember that your subjective data that you will be collecting is from the client and only from the client. You obtain that information through your client interview, through therapeutic communication techniques, active listening. It's all about what the patient feels and their symptoms. That's what your subjective data is. It is what the patient tells you, and it is verified by the patient, by the client. We will be talking more about objective data collection in the next presentation. So to wrap this presentation up, I'd like you to take a look at our objectives and make sure that you are able to meet all of these 6 objectives. If you have questions, please do not hesitate to reach out to me. Take good care.